Good morning, good afternoon, good evening, depending on where you're watching us from. It's your friend again, Nurse Immaculate, the indomitable nurse. All right, just a quick one. I want to answer a very question that someone just asked me. It's not a funny question anyway because it's very, very important. And the question is this: can I actually breastfeed while HIV positive? And I said yes. So I want others to benefit from it, and that's why I'm doing this video. You can actually breastfeed even though you are HIV positive. Yes, it is not the end of your life. If you discovered it before you got pregnant, there are things we would have done together with you and your healthcare provider to make sure that your viral load is reduced and your CD4 is increased. Then you can have your safe baby, because even at delivery, there are things we need to do to make sure your baby doesn't come down with the same infection. But if you didn't do all that before, fine, there is no problem. And now you have put to bed, you are asking if you can breastfeed. Perfect, you can actually breastfeed. But the thing is, if your baby haven't gotten it before then, because there are 3 points from which the baby can actually get infection from the mother. From the point of delivery, in utero, the baby is protected. In your womb, the baby is protected. The only thing that can make the baby get it from you while in the womb is infection. But if you were sure that your pregnancy was uneventful, you didn't have problem, you were not falling sick, you were not treating one infection or the other, fine. You can be rest assured that your baby is protected, because the baby is in a sac, well covered and well protected. Your blood does not mix with the baby's blood while in your womb. That is where God did all the magic, in fact. But from the point of delivery, we have to be careful, because by the time the baby wants to come out, the processes involved, there are points where the blood of the mother and that of the baby would mix if time is not taken at the delivery. That's the first point where the baby can now get this infection from you. So knowing this, the healthcare providers have some measures to protect you protect the baby from getting it. We have some measures that will tell you before you put to bed that this needs to be done. And some of those things that need to be done is that CS is one of the safest methods. Just do CS and bring out the baby without any much interaction with the mother's blood. The baby will be fine. Then aside that, if you want to go for vaginal delivery, there are techniques in order to make sure that this baby does not contact your blood. One, the baby can swallow your blood while coming out through vaginal delivery. It can enter through the nose. So if the baby is presenting with the face, it is not advisable. Take that baby straight for emergency CS, so that the baby doesn't sniff the blood. Or the midwife can manipulate and turn the head of the baby facing down, so that the baby does not have to take in the mother's blood as it's trying to come out. That's one. Two, we don't give episiotomy to such women, because it will enable the blood flow from the woman to become more, and then the risk of the baby getting it is more, because the blood can enter her eyes, her nose, her ears, and all that, and flow into her system, or the baby's system. So we try to prevent all that. We don't give episiotomy. We manage the perineum well, so that the baby comes out smoothly. That's one. So if the baby have escaped this point and didn't get infection at this point, yes, you can breastfeed. The next place you can get it from is from breastfeeding, quite all right. But that breastfeeding, between the first month and the 6th month, the baby is safe. There is no likelihood of the baby getting at this point, because the baby doesn't have teeth yet and cannot bite you. But after 6 months, it's advisable you stop. You stop at the 6th month. You stop is that you stop. This is where I have issues with women, because I can't stop. You just have to stop at this point, because the baby has started developing teeth at this point and can easily bite the nipple and suck the blood in. And then all the prevention you've been doing all along will become a waste. So at this point, this is what happens. Now, if you don't want to breastfeed your baby and you say you don't want to take chances, you can use formula feeding for the baby. It's okay. The only difference is that breast milk has more immunity, confers more immunity to the baby than the formula feeding. Yes, so you have less times to run to the hospital for your baby being ill and all that when you breastfeed, even as a HIV positive mother. So that's what happens. The next time when the baby can get this is after that breastfeeding stage, is at the time of maybe as it's growing up, injections and things like that. So one now have to be careful for all those other things to make sure that the baby doesn't come down with it. So, but there are interval tests we do for the baby. We test the baby at birth, we test baby at 6 weeks, we test baby at 9 months, and we test finally at 1 year 6 months. At 18 months, we can certify and tell you whether your baby came down with this or not. So after the first stage at birth, that's to show us that this baby did not get it at birth. And then immediately 6 weeks, we test again to be sure that there was no infection of HIV in this baby before now. After 6 weeks, we check again at 9 months to be sure that though you stopped breastfeeding at 6 months, even if the baby had gotten it at 6 months, we'll be able to see it at 9 months. That's why we check again at 9 months. But if after checking 9 months and it is still negative, wow, praise the Lord. And I tell you, I've had a lot of babies like this. From pregnant, positive mothers who delivered and the baby at 1 year, 18 months, finally tested and certified negative. It is doable. You can do it. It's not a problem. Thank you.